Dr. Frumkin, the U.S. Supreme Court decision in Massachusetts versus EPA required the EPA to determine whether greenhouse gas emissions can be reasonably anticipated to endanger public health and welfare. Despite apparently EPA staff's finding that it did, the administrator refused to sign off on that endangerment decision. I just want to ask you, based on your considerable expertise in public health, do you believe that greenhouse gas emissions cause or contribute to air pollution which may reasonably be anticipated to endanger public health?
Thank you for the question. I recognize that there are legal and regulatory dimensions of that question. CDC doesn't have a position on those issues, and nor does it have a position on any of EPA's regulatory decisions. What I can do is speak to the public health science. The science is clear that carbon dioxide does contribute to climate change. And as I and others have testified here today, climate change does pose a number of public health challenges.
I kind of take that as a yes, that it does have the capacity to endanger public health. Is that a fair statement?
I think I'd let my words speak for themselves.
I think we got the message. I wish the White House did. I wanted to read a quote, actually, which was one of the, if you believe in irony, this is one of the great ironies, in turning down California's request for regulation of greenhouse gases. The administrator of the EPA said, quote, "Severe heat waves are projected to intensify in magnitude and duration over the portions of the United States where these events already occur, with likely increases in mortality and morbidity, especially among elderly, young, and frail. Ranges of vector-borne and tick-borne diseases in North America may expand, but with modulation by public health measures and other factors." Would anyone disagree with the position that if you conclude that, you by necessity have concluded that carbon dioxide has the capacity or capability to endanger public health? Does anybody disagree with that in this panel? No, sir. If you were going to reach that, I'll take that no one disagrees with that. Next question is, public health experts, we have been struggling with how we get America to move on global warming. You have seen the federal government largely acting in the last 7 years under this administration much more as the ostrich with the head in the stand and the tail feathers in the air rather than the American eagle, and we need to change that. As public health experts, can you help us on what you think the best messaging is to the American people on trying to tackle this beast? How do, you've been successful in seat belts and changing behavior, you've had some success in tobacco usage. What messaging works to help move America in this direction?
Mr. Inslee, I think, at least from the American public health perspective, we need to change the message from the end of the world, there's nothing we can do, till this is a very significant problem, and every one of us can do something in an incremental way that will make a big difference. I think that what often happens with big problems like this, people get overwhelmed. And so from our perspective, simply telling people again, travel differently, do some things differently at home, do some things differently at work, and letting them know that every little bit helps will make a big difference.
Dr. Patz?
Yeah, if I could just add, I think that the issue of co-benefits, that in fact this could be a great opportunity if we think about changing some of our energy policies, especially in the area of transportation. 60% of Americans do not meet the minimum recommended level of exercise, and this is one where we've sort of designed unhealthy cities, and this is a great opportunity when we think about greening cities, reducing greenhouse gases and automobile traffic. We have a great opportunity to enhance personal fitness. Another point that I think is both locally, as Dr. Jacobson pointed out, regarding CO2 emissions affecting California, but also that in fact our CO2 emissions do affect the world. And just like the argument of secondhand tobacco smoke, where what one individual does and lights up a cigarette and that smoke affects someone else, this is actually a global problem as well, and that our energy emissions are in fact hurting other countries, not only our own. So I think that's a message as far as an ethical issue.
I appreciate it. Dr. Frumkin, did you want to add something?
Yes, sir. Just to let you know that CDC has been holding a series of expert workshops on various aspects of climate change. The most recent one was on health communication regarding climate change, precisely because we recognize the question that you just posed, that public health communication has been very successful in many domains. What can we learn from that to apply to climate change communication? We know, for example, that bad or threatening news is difficult for people to take, but if it's coupled with constructive recommendations about what you can do, it's much easier for people to accept that news.
Well, some of us believe, and I appreciate Dr. Menden's comments, that we need to switch from doom and gloom to a sense of the can-do, innovative, optimistic spirit of America. That is an American message. I believe it will succeed here.